Going to go over a way to tape a hamstring. Now, to do this, you do have to expose someone quite a bit. So to keep this person's privacy intact, we're going to just do it over her pants. Obviously, you don't put the tape on over pants, but just for an example, that's how we're going to do it. So I've got 4 pieces of tape. Now, the first 2 pieces are going to be shorter, and I'm going to take them across wherever the hamstring is painful. So as I look at the muscle belly here, a lot of people will have pain typically where the hamstring attaches, so that pain may be right up underneath the bottom of her hip, where it's getting ready to attach to her pelvis. We may have a strain or pain in the hamstring that's somewhere in the middle of the muscle belly, or maybe further down where it attaches behind the knee. I want to use these 2 pieces to run perpendicular to the hamstring to try and offload wherever that pain is. Now, I'm going to use Kinesiotape. You can use a more rigid tape for this part to really put something tight across there. So I want a piece of tape that's not going to cover or wrap the whole way around her thigh. I'm going to tear a small little piece of the paper. And if this is more her medial hamstring, I'm typically going to start on that side and pull across. If it's more of her lateral hamstring, I'm going to start on that side and pull across. So let's say it's her medial or more inside aspect of her hamstring. And let's say the pain is up towards the top, right here. So I'm going to come just down below that pain to start. And I'm going to lay this on her skin, but for this instance, her pants, right? And I'm going to peel back some of this paper. Now, this is a tough one to do yourself. You can see I have her laying across the table. When I have her laying across, I want there to be a little bit of tension on the hamstring, but short of pain. So that's the position I have her placed in, over a table or over a desk. Now I'm going to start off with no tension on the tape, right? And let's say her pain is right here in that medial hamstring. Once I get close to that point, I'm going to pull pretty hard. So pretty much maxing out the tension of this tape. As I get to the other side of her thigh, and then I'm going to release tension and just lay it on. Okay? And I'm going to do another piece, same thing. So I'm going to go right down below it. I'm going to follow a similar path. I'm just going to lay it on the skin. I'm going to peel back the paper. No tension at first, and then once I get to where that pain typically is, I'm going to pull pretty hard, come all the way across, and then once I get across, no tension on the tape, just lay it on. So that's because her pain was up towards the hamstring attachment. I will do this further down, whatever location is most painful, right? And then next, I'm going to have 2 long pieces that go across the length of the hamstring. Now, same thing, assuming that hers is more on the inside, I have her in a position where she is just short of pain, right? So if this bothered her and this was too uncomfortable, I may prop her foot up a little bit, which would make less tension on the hamstring. Vice versa, I could have her lay over further to put more tension. But I want to be just short of her symptoms. And I'm going to try and come down and go just across the inside of the knee and just lay it on the skin. Now, I want there to be a little bit of stretch in the tape to help control or limit how far she's going to be able to stretch into that painful zone. So if I have her right at the edge, if this is 100% tension, I want kind of maybe 50%. So that there is some support there. I'm going to maintain that tension. I'm going to hold her pants down because this is not her skin, right? Ah, thank you. And I'm going to 50% tension as I run right up along the path of that hamstring on the inside. I'm going to come right up past the point of pain, and then once again, no tension as I lay this right on the back of her hip. And then similar concept right next to it. This is going to be a little bit more towards the middle of the back of the thigh. Okay, once again, no tension to begin with. And then once I get up past the knee, I'm going to apply that 40 to 50% tension, very lightly following the path of that hamstring. As I get up past that painful zone, right here, and then I'm once again just going to lay it on the skin. And I could run that all the way up even a little bit longer up to the top of her glute, right? So obviously this tape is going to pull back a little bit, but as I give it a quick rub, that gets it to adhere to the skin. If you have a little larger area of pain, you can do 3 pieces across. And like I said, you can use a more rigid tape for these, but the stretchy Kinesiotape works really well so that as she's running or walking or doing whatever seems to put tension on her pain, that tape's going to absorb a little bit and stretch to try and limit her capacity to overstretch her hamstring. Thank you.